Hello, I'm Sydney Sensikovic and I'm a registered nurse in Pennsylvania, and this is my nursing capstone reflection video for NURS-FPX4900 Assessment 5. For the first part of this video, I will discuss the interview process that allowed me to create an intervention that targets high-risk stroke patients to help them prevent impending or recurrent strokes. Throughout the interview process, I chose to interview professional subject matters in the field of neurology that I have the absolute pleasure of working with every day. Between Dr. Frank Zhang and my friend and mentor Lisa, I have gained a wealth of knowledge on how I can adequately execute my intervention to help improve outcomes for confirmed or potential stroke patients. I met with Dr. Zhang and Lisa totaling roughly about 9 hours on numerous occasions between both of their offices for the sake of the interviews. The problem I was addressing with them was regarding the lack of knowledge individuals truly have when it comes to stroke and how to appropriately educate them on the importance of immediate recognition of stroke-like symptoms and when to initiate emergency medical services, or EMS, for transportation to the nearest hospital. Coinciding with patient education, it is also imperative that EMS crews have the appropriate education and tools readily available to recognize a stroke, along with healthcare facilities not affiliated with acute care hospitals to do the same for their populations. My intervention consisted of the creation of an educational brochure that would highlight important details regarding stroke recognition and severity, available treatments, risk factors, and stroke-related informational resources in a simple-to-understand manner. This intervention will be applied by helping individuals to understand the seriousness of seeking immediate emergency transportation to a hospital should they feel that they are having a stroke, and the importance of follow-up care if it's confirmed. With the proper knowledge base, stroke outcomes can overall be improved by earlier recognition and treatment to promote a better recovery. Overall, conveying the information in a clear and concise manner in layman's terms for those who are non-medical can help save a life. My intervention serves as a reference that can be used as often as it needs to be in the event someone is exhibiting stroke-like symptoms, whether it is a loved one who witnesses it on their person or EMS while transporting a patient to the hospital. The intervention is simple, and the acronym BFAST can be applied to teaching to help and make it easier. BFAST stands for balance, eyes, face, arm, speech, and time, and represents the sudden signs of what could be a possible stroke. Potential challenges that can affect this intervention would be patients who are stubborn or not receptive to teaching, such as those that won't admit it to their family if something isn't right, and cognitive or cultural barriers that may be present. In the event of cognitive or cultural barriers, the brochure could be adjusted to better fit their needs related to mental capacity and language translation. Dr. Zhang is a huge advocate for patient education, as is Lisa, so they were very supportive and on board with providing me with necessary information to aid the creation of informational brochures, especially ones that were inclusive of the BFAST acronym. As I have seen patients come into the hospital with stroke scares, it is observed that there are patients and loved ones that truly don't know all of the symptoms of stroke or what the appropriate action is if an individual exhibits stroke-like symptoms. No instructions were necessary pertaining to the brochure, other than perhaps explaining to patients how to access the resources provided via the internet if they are unsure how. Teaching them until they can effectively teach it back is one effective way to evaluate the success of this measure. The patient and family will have these to take home with them, and they may even use it to do some teaching of their own to others. Part 2 starts with literature. So throughout this project, aside from physically consulting the experts, I utilized credible, evidence-based resources to formulate an intervention and create my brochure focusing on stroke information. Data was retrieved from websites with endings such as .org, .edu, and .gov. Additionally, I only used research articles and studies that were peer-reviewed and published within the last 5 years to ensure the information was up to date. These methods helped confirm that credibility was applied to the resources utilized for my research, and that I was using the most current information in a constantly evolving healthcare world. The Centers for Disease Control, or CDC, World Health/Stroke Organization, or WHO/WSO, and the American Stroke Association were accessed regularly throughout my Capstone project. Websites such as these are easy to understand for the layperson, and they serve as fantastic resources for patients post-stroke to help them with the support they will need to enhance their recovery. Next is the technology to improve outcomes. The technology recommended to my patients that is included on the brochure was useful websites such as the American Stroke Association, for one example. I included this website because it is easy to navigate through and the material is simple to understand without medical jargon that may confuse a non-medical person. This website also allows patients and/or loved ones to search for local support groups or even virtual ones should that be a better option for them to remain at home but still get the necessary support they may need to get them through this hardship. A website is a simple suggestion because even in the older populations, there is a high chance that they have a loved one that has internet access that can help them with something like this. In this modern day, a majority of people have smartphones and easily accessible internet right at their fingertips. During education with patients, it is also helpful to propose the utilization of telemedicine for future use of follow-up appointments. Sometimes there is a lack of follow-up care due to patients being unable to take time off from work after hospitalization, finding a ride, or just not wanting to leave their homes for whatever reason. Suggesting telemedicine can help improve follow-up compliance as it is simple and convenient as long as the patients have decent internet access with video chat capabilities. Again, this is the era of technology where almost everyone has a smartphone of some type with readily available internet access. The up-and-coming generations are heavily involved with technology, suggesting that in the near future, we may see a lot of telehealth services being implemented more frequently, and that was retrieved from Fahim et al. 2022. Telemedicine is always something we bring up in conversation to help give patients more options moving forward should they have any challenges that may prevent them from seeking follow-up care, as it is super important to promote better outcomes and prevent recurrent events. Next is health policy implications. The health policy most relevant in regards to stroke patients would be the Affordable Care Act, or the ACA, otherwise known as Obamacare. The goal of the ACA is to make healthcare more affordable while simultaneously improving the quality of care rendered and reducing unnecessary spending, and that was retrieved from Sasank Isola and Anil Kumar Reddy Vari 2019. For someone with a multitude of risk factors or one who has already had a stroke, this is an ideal health plan for them. The plan is beneficial for someone who is no longer able to work due to remaining deficits post-stroke because it provides many health options that meet the patient's needs, as opposed to putting a limit on what the patient can afford. Obviously, stroke patients are going to require a lot when it comes to their healthcare post-stroke. Suffering a stroke can come as a financial burden, but giving these patients the opportunity to receive affordable health care and medications could increase their compliance moving forward, thus decreasing their chance of having a recurrent event. Next is Capstone project outcomes. Before I even started this project, I knew I wanted to do it on stroke, with a primary focus on education, as that is a huge component of my job description. I have not had anyone close to me personally that suffered a stroke, thankfully. However, I work with whom I feel is the best of the best when it comes to neurological issues and disease processes. Within the last year, I have learned so much from the neurologists I work with daily and my friend and mentor, Lisa. They are both a wealth of knowledge, and by spending the time that I did with them, I can take away key elements on how to appropriately and effectively provide stroke education to my patients. I was hesitant at first, knowing I did not personally have someone to interview that actually went through it, but by reflecting on all my patients over the last year and interviewing 2 expert subject matters has helped me in substantial ways, not only for this Capstone project, but in my career as well. By asking them questions based on the topics provided to me, I feel that I have learned so much to grow within my professional scope and can pass that information on to my patients and others. Throughout my research and preparation for this capstone, I learned a lot about stroke education and how to appropriately deliver it in ways that benefit the patients as opposed to what is required. It is crucial that stroke education is delivered consistent with appropriate content that is easily accessible and effective and overall meets the patient's personalized needs, and that's retrieved from Finch et al. 2022. By touching on the basics and focusing the most on personalized risk factors for the patient, they become more receptive to what is important for their care moving forward in order to prevent any recurrent strokes. So my personal and professional growth. At the beginning of this journey, I had been out of school for 6 years. I would be lying if I said this wasn't an overwhelming choice at first. In fact, it took me about a month and a half just to make it through my first class. I've always wanted to pursue a higher education once my family was complete, but after all the time that passed, that goal got pushed farther and farther onto the back burner as my focus shifted to my family and personal life only. My husband was advancing academically, so I was unsure if it would even be realistic for me to also go back to school at the same time, knowing we both work full-time and are now raising 3 little ones. Ultimately, my employer had come to an agreement with Capella regarding tuition coverage, and that was the push that I needed, because I wasn't sure how long these benefits would be offered. The tuition assistance was too good to pass up considering the high cost of obtaining a college degree. Once I made the step to go back to school, all I could focus on was making my children proud of me. I know they're still little and don't understand what I'm doing or why, but knowing that someday they will is all the motivation I needed. Within the last year, I left bedside nursing to pursue a stroke program coordinator position. Initially, the position required the candidate to hold a bachelor's degree. It was hard for me to understand at first, knowing that I had an emergency room background and knew I was fully capable of taking care of stroke patients. Well, I learned the reasoning very quickly. A lot of what I'm doing on the non-clinical side was reflect on what I was researching and writing about in my classes. I could take away so much of what I learned while going through this program and apply it to my everyday job. I'm glad that I chose to do it this way because as I was navigating through the school and the different courses, I was able to apply it to my everyday practice at work. Thank you.